Hello everyone, my name is Sofia Komisarova and I'm here today with Fulvia Raffaelli, the head of the Digital Health Unit of the European Commission and one of the CARE Summit speakers. Thank you so much for being here with us today and for sharing your thoughts on the event. And the very question is very basic. What are your first impressions of it?
Very good. Every event brings together stakeholders that facilitate conversation, and breaking the silence is very welcome. The European health data space, but in bigger terms, the digital transformation of the healthcare sector does require a lot of communication. So events like this one that brings together stakeholders from different communities, researchers, healthcare professionals, and industry and other member states representatives are very welcomed.
Thank you so much. And as you probably know, the final goal of this event is to co-create the roadmap for a stronger European Health Union. And in this regard, what would be your key recommendations or maybe key takeaways from your today's session that you would give us to leverage the European health data space?
Well, my key recommendation is to be very pragmatic in the approach and also considering the use of data as an underlying conditions for building up this European Union. And data are a very precious resources that we have it in Europe, but still too often in silos and not interoperable across the different areas. That's the key. That's the key area where we need to work together to facilitate the access to this data and to make them usable across the different sectors. The One Health approach requires data from different sources, from not only from health, but also from environment and many different impact areas. So the interoperability across data is really a keyword. And the European health data space, by defining what we call the European exchange format, can really play an important role in reaching that interoperability. Information needs to be the same across not only within the single member states, but also across member states, so that innovators and research can really look at those data from different sources and using them in their researches. Today, with the uptaking of AI technologies and tools, this is even more important than it was a couple of years ago. Data are research with the AI are as good as data are good. So let's work together. There are a lot of expertise across sectors on quality data. Now let's put it together and be pragmatic in identifying a common language that can really make of these big resources that we have in Europe an advantage and even a competitive advantage for our industry. Always, of course, keeping a patient-centered approach with a high level of respect for privacy and without never losing sight of what is more important for us, which is the outcome for the patients.
Thank you so much. Thank you for sharing your perspective.
Thank you to you.